Hi, I'm Stephanie, and together with Nicole, we make up a PT-OT duo, the Note Ninjas, to help other PTs, OTs, assistants, and students with activity ideas and documentation. So today, we have a fun activity. I'm using a walker just because I know a lot of patients have one and they might feel more comfortable for this activity. You don't have to use one. You could also progress this patient to maybe sitting on a foam pad or something. So wherever your patient is at, this is right for them. Actually, you can even do it in sitting if they're lower level. So I would have my patient with their back to the wall, and I will have them use their opposite hand to reach over and touch a target. Reach over and touch. So on this one, I have 3 different targets. So I'm really working on more of flexion on this, more just straight over, and more reaching down. It's just to really get the mobility of the shoulder. I am also working my core with the rotation, and I'm working dynamic balance, especially if I'm not using the walker. If you can tell, I also have my foot rotating, to kind of give myself a little bit more rotation. But if they don't have that, you could also just reach. And you can progress this activity. You can start maybe with the middle one and just going straight over, crossing midline, or you can go up, down. You can call out colors. You can call out up, middle, lower. You can keep it varied. You can change the speed you call it out. You can have them reach past to really reach even more. This can work on so many activities. And so in your documentation, you want to write what it was working towards. Is it working for the dynamic balance when walking, or for reaching an items at the grocery store, or for showering? Or are you really trying to get that shoulder range of motion, maybe for like the seatbelt in the car? Whatever you are doing, your intent of the exercise, what functional activity it's trying to improve, but then your documentation, briefly say what the activity is, and then make sure you write how you cued the patient. Did you cue them? Did you give them tactile cues at their core for facilitation? Did you have to give them physical assist because they lost their balance? Did you progress the activity to having them reach past the target, or to now varying the heights? Whatever you did is showing the progress and showing your skill, and it's related to a functional activity. So it's a great activity for you to do. Your insurance companies will be happy it's working, and your patients will be happy they're making their goals. So for more activity ideas and documentation tips, make sure to follow us at the Note Ninjas.